Can you talk a little bit about that kit and what's in it and why it's necessary?
Yes, I actually have a kit, but I
Oh.
want to talk about what the kit is about. So two things. One, most women in the world deliver at home. They deliver at home because there aren't enough clinics and hospitals that are close to where they live or that have services or have physicians. So many women, more than 50% of deliveries happen in the home around the world. So these kits were originally designed for a home delivery where they have like a traditional birth attendant or someone at bedside that has nothing. You know, these are lay workers that live in the community with the mothers. They don't have money. They often don't have resources. So these kits were for them to help with the mother's delivery. Now, the first thing, well, this one has others. This has this instructional sheet. And I don't know if people can see it, but it's like an IKEA diagram, I call it. So it's a flow sheet. It doesn't actually require that anyone be literate. So that's really important. We make use of pictures, pictorial diagrams in order to educate, because in many areas of the world, you know, these traditional birth attendants and even the women themselves are not literate. So it goes through the steps of a delivery using Purell. So we include Purell in the kit because there's no running water in most of the world. I think people may not realize that, or the water may not be sanitary, right? So this is Purell to help clean the hands. Then the first step is wear a pair of gloves. In many areas of the world, there are no gloves. Deliveries are done barehanded because you can't find something as simple as a pair of gloves. And of course, that's an infection risk because, you know, we know from just basic sanitary practice that hand washing is extremely important. This is the flow diagram. So you put on the gloves. If you do have clean water, there's a small bar of soap. You can wash the perineum as well. You put the mat under the mother, which is also in here. It's just a clean rubber mat, just so she doesn't deliver on a dirt floor. Then you tie the cord, you clamp the cord, and you cut it with a razor blade because it's a non-reusable item that then won't go on and be used for a number of household chores. And then you clean the baby, hat, blanket, very simple things. And on the back are when you refer the mother because she's not doing well progressing at home during delivery. She's having shakes, she might have preeclampsia, she's been laboring too long. That might develop a fistula. She has a fever. You need to send her to the hospital, or she's bleeding too much. She could be hemorrhaging, so she needs to go to the hospital. So these are all the items: cord clamp, you know, razor, baby hat, baby blanket, very basic things.